So in our mini course, as we're learning the initial assessment scorecard to help you have easy, accurate, efficient protocols every time, you'll always know what to do with your clients. So as we go through the scorecard, you have this in your course. I would suggest that you print it off and that you have it accessible, that you have one that you can get ready to copy and use with every client, and that you have one that you use as a way to take notes on our videos as we work through together, okay? So let's get started right away. There are really 6 absolutely standard markers. And no matter who I see, no matter what their diagnosis is, no matter how severe, how complex, how impossible it seems, I use this initial assessment scorecard for everybody. So whether it's my own comprehensive appointments or I've trained my team to have our initial consultation screening appointments, I train my team to use this scorecard, and I still use this myself. It is one of the best documents. I have 7 absolute must-have systems that we have to be able to set up and have a healthy, profitable, scalable health and wellness practice. So print off your scorecard and let's go through them one by one. So in this video, we are going to talk about number 1. The first thing that we have to assess, the first marker that we have to evidence for is there signs of inflammation? And I do not mean, do we see a swollen ankle? Do we see a swollen elbow? No, it's not about seeing the inflammation. This is about cellular inflammation. Now, I happen to use bioenergetics equipment. I love the company International Health Technologies. I've used them since 2007. There are a number of ways that you can work through an assessment with somebody. You can use bioenergetics from IHT like me. You can use EDS technology. You can use what is that called? The Young Living has I can't remember what it's called, but you young Living people will know. You can be a doctor, a clinician, and using blood labs. You can use a questionnaire. You can use a health assessment questionnaire. Every one of these models is going to have a way for you to assess, is there cellular inflammation? You just have to be able to know how to identify it. That's it. So if somebody comes in, for example, with labs, and they had a erythrocyte sed rate, that is a sign of inflammation. And we would put a check mark in the evidenced column. So the columns are marker, evidenced, NA, which means not accessed. Sometimes that is not accessed, not assessed. Sometimes that means not applicable, but for us it means, did we assess it or not? And then I leave a column for interventions or notes. I'll give you some of the interventions that I in particular use. So if you are using labs and you have tested for labs and you see that there is signs of inflammation, doesn't matter how, doesn't matter where they're coming from, you evidence that, you put a check mark in that column. If you are using something like an assessment device, like a bioenergetics tool, or muscle testing, kinesiology, you are assessing for the word inflammation. You are looking for panels on the bioenergetic assessment for inflammation. Now, on those panels, if it's anything outside of the green, you see pink, red, you see black, blue, whatever the colors that the company uses that show cellular inflammation, that gets a check mark in the evidenced column. Inflammation is the number 1 top marker that we have to see, because cells have to do 3 things: nutrients in, waste out, and then reproduce healthfully. And they will reproduce whatever the program is. So if they can't do that because they are swimming in inflammation, we're going to have all kinds of dysfunction in the body. So the absolute first thing we have to assess, in no matter which way you choose to assess it, we have to assess for inflammation. Now, for the purpose of this video, I'm not going to go into all of the possible assessment types. That would be something that if you're in practitioner's protocol with us, yes, I would walk through helping you select what would be your best assessment tool, and then teach you directly with what you want to do to assess inflammation. But whatever assessment tools you have decided to use, you are looking for cellular inflammation. If you do not have the budget for tools, you don't have any equipment, you can get my book, I Speak Symptom. In that I Speak Symptom book, you're going to be able to help people organize their symptoms and track as you go through their progress. And it has every protocol and suggestion that I have built over 19 years in practice. So you can use I Speak Symptom, the trackers and the protocols that I put in there as a way to assess inflammation. It is using metabolic symptom tracker sections, and it is listed on your tracker form, which MSX, that's what MSX means, metabolic symptom tracker. And I will tell you which section you are looking for to look for inflammation. If you did not assess it for some reason, you're going to check in the not assessed column. In the next column, I'll write some notes. So maybe the client is talking about how I just feel puffy, I feel bloated, I feel like I'm carrying water weight, I seem to fluctuate in weight up and down. From morning to night, I'll be very different. That's a sign of some fluidity challenges. That's a sign of some inflammation that is going to be involving cells. I might also write some notes on potential interventions, some nutrition that we can use. Some of my favorites are one called IFC, which is from Cellcore Bioenergetics. I love tricurcumin from Deseret Biologicals. I love using our far infrared sauna. If somebody does not want to use supplements, we'll use something like far infrared sauna to help decrease inflammation. I like using something like a digestive enzyme or Wobenzyme in between meals, because that can help eat up anything that is floating around in the blood that should not be there. Those are some really easy, simple supports that I particularly use when I see evidence of inflammation. Now, the point of this scorecard is not to match the herb to the headache. That's not our point. That's just some of the things that I write in this section as I am interviewing with the client. I am taking notes on how else might be they might be evidencing cellular inflammation through their symptoms, and those are the notes that I will be taking. What's going through my head as far as what possibly could I offer as a resource or as a technology that I have that could benefit this person as we're talking together. I'll jot that in the note section there. So first marker, inflammation. Let's move on in the next video to number 2, marker number 2.